you've ever been administered anesthesia during a medical procedure. These procedures might include wisdom teeth removal or another type of surgical procedure, either in a hospital or other medical facility. Now, did it ever cross your mind as a nurse was injecting the anesthesia into an IV or putting a mask over your face, who is this person? What makes them qualified to administer this dosage? For many, it's a question that does not always cross our mind, but for some, it could lead to a newfound interest in this field of medicine. For me, a career in healthcare has always been a dream of mine. After looking into the various health professions that I could pursue, I stumbled across a nurse anesthetist and just thought, oh, it's the person that puts you to sleep during a medical procedure. However, while I was doing my research on the profession, I found myself more drawn to applying to a nursing program and a master's in anesthesiology after I graduate. Through this speech, I want to inform you about the career of a nurse anesthetist, the tasks that a typical nurse anesthetist will be expected to perform, the type of personality traits that they are expected to have, and the amount of schooling that they will endure. Nurse anesthetists are specially trained registered nurses who administer anesthetics to a patient who is undergoing a procedure that requires them to be put to sleep. They are part of a surgical team that will commonly work under the attending surgeon or another anesthesiologist. Prior to any procedure, a nurse anesthetist will meet with a patient and their family to discuss any concerns, allergies, prior illnesses, or injuries in order for them to deliver the anesthesia safely. Some of the other duties might include prepping equipment and supplies for procedures, studying and interpreting pre-surgical tests to know how anesthesia will affect the patient, and making sure that adequate blood supply is available in case of an emergency. Besides administering the anesthesia, nurse anesthetists are also trained to monitor patients' vital signs and are able to make any necessary adjustments to the dosage of administered anesthesia. They also perform other tasks while in the surgical room, such as inserting artificial airways or administering oxygen to a patient. Now that we understand the tasks that are expected of a nurse anesthetist, it is important to understand the personality traits that encourage for this profession. Nurse anesthetists might also be called upon to perform other clinical tasks that rely on communication, such as performing physical exams, ordering diagnostic tests, evaluating test results, and administering medications or treatments. They also provide counseling for a patient and their family in order for them to know how to manage a certain condition and remain healthy after they leave the facility. Having good interpersonal skills is important to becoming a nurse anesthetist, since they will be able to communicate with both their patients and coworkers to ensure proper care. A compassionate nature also helps in being able to put a patient and their family at ease if they are either stressed or in pain. A nurse anesthetist will also have to be very detail-oriented during measurements of medication and anesthesia because of the preciseness that's required. In the face of the dilemma, they are also expected to be able to think on their toes and determine the best course of action for the patient. A final characteristic that a nurse anesthetist should be able to possess is leadership. In a typical work environment, they will be looked to for resourceful and innovative ways to handle a scenario or a problem. Now that we understand the personality traits that are encouraged in a nurse anesthetist, it is important to understand the schooling that is required to earn this degree. To become a nurse anesthetist, they must first obtain a Bachelor's of Science in Nursing from an accredited nursing program that incorporates both classroom work and clinical rotations in major health departments. Nursing programs also include courses in anatomy, physiology, biology, psychology, and pharmacology. Through completion of this program, and after passing the National Council licensing exam, they will become a registered nurse. After they are required to work as a nurse in an intensive care unit or ICU for approximately 1 to 2 years before applying to the Nurse Anesthesia Master's Degree Program. The Master's Degree Program in Nurse Anesthesia requires a minimum of 27 months of full-time attendance, where students will learn how to operate anesthesia equipment and manage or react to surgical and emergency situations that require anesthesia. They also are enrolled in courses of anesthesia pharmacology, anesthesia pathophysiology, and pain management. The final step to becoming a nurse anesthetist is to take the national certification exam. After passing that exam, they are now a certified registered nurse anesthetist and are free to practice anesthesia in any field of preference upon being hired. Preparing to become a nurse anesthetist is not an easy process, but in my opinion, if you enjoy helping someone live a longer or better life, it is worth the long hours of studying for an exam or the strenuous clinical rotations during the nursing and anesthesiology programs. Today we have examined the career of a nurse anesthetist by looking into the typical tasks they are expected to perform, the personality traits that are encouraged, and the type of schooling that is required to earn this degree. So the next time you or someone you know is going into a procedure that requires anesthesiology, remember, the intensive training that a nurse anesthetist is required to perform and understand in order to ensure your safety and well-being is their number one priority.